to oh, there we go. And we're recording. Anyway, thank you for joining. We have quite a bit of information to get through today. And we'll do our best to answer your questions and monitor the chat. And you can leave your camera on or turn it off. It's completely up to you. You can unmute and ask questions. And then if you feel more comfortable, you can just throw your questions in the chat box. Ann and I will try to keep an eye on that. And then after the session, within the next few days, we'll send out the recording of our presentation along with any handouts and a certificate. And we'll also post it on our YouTube channel. But if it's just watched on our YouTube channel by somebody else, like if you share it with somebody, they won't be able to get a certificate because you have to actually be present to get one, but they'll still be able to view the resource, which is really handy. Okay. All right. So getting started. Everybody's probably in a different place in their independent provider journey, but Ohio follows a free choice of provider. So people who are enrolled in a waiver, they're assigned an SSA, which is a service and support administrator, and they're assigned by the county board. So the SSA assists the person and their family with, sorry, or their guardian for going through the free choice of provider process. So through that process, they identify any willing and able certified providers. That's you guys too, right? Independent providers, willing and able providers. So during the meeting, they're going to talk about what's important to and for the person. They're going to talk about the outcome of the person's assessments. The assessment identifies the person's needs. It determines the amount of funding available through their waiver, which pays for everything, which pays for the services. During the team meeting, it will be determined what services the provider will provide, the frequency to which you'll provide those services, and the goals and the outcomes that you'll be required to document on. The ISP will become basically your job description, and then for everyone that is providing paid or unpaid supports to the person to help them meet their needs. So basically, the ISP, once once a person chooses you to provide the services, you review the ISP, you sign off on it. That's like signing off on your job description to provide care for a person served. So just like any other job description, the ISP is going to guide you on what you're responsible for providing, the hours that are approved, the expected outcomes of your work, and everything that you bill for must be able to be tied back to the ISP and the services identified in the plan. Does anybody have any questions on that
I
piece?
have to call on because this is.
And I noticed that these are like closing down, and I'm writing.
I can't tell if that was a question for me. I'm so sorry. I'm gonna keep rolling. So service authorization. So based upon the individual service plan, the county board puts funding in place in what's called a pause. It's payment authorization for waiver services, basically. And they put that in place. So once you provide the services, then you're able to bill for those services. So the pause authorizes the number of
I can't hear anybody.
the pause authorizes the number of units and the total amount of money that DODD can pay you as the provider. And the ISP authorizes the service, while the pause or the payment authorization is what pays for the services. Okay. So I don't know how many of you guys have been able to log into DODD to be able to view the pause. But this is the steps on how to view the individual pause to see what's actually authorized. So hopefully you're all been able to log into the Ohio ID. So when you go to DODD's website, you're going to go log in. if you can see on this, there's a little person on that upper right-hand corner. Anne's got her cursor circle on it right now. So there's a little person. When you click on that, it gives you the login page. So you'll put your user ID and your password on this page. And I'm believing it's the same place you would have logged in when you very first set up your to be an independent provider. Okay, next page. So once you hit the login page, and these are just screenshots to kind of walk you through it, you would just go in and continue with your provider profile. So you're going to click on continue. And then once you get to that screen, you're going to come upon an applicate or it's going to have a banner across the top. It's going to say homepage applications, My Learning. You probably do your My Learning here, right? So on this one, you're going to click on applications. And then once you click on application, you have several tiles to pick from. I call them tiles, little blue tiles. So where you're going to want to go to look at the pause is the MSS. And Anne is highlighting that with the cursor. MSS. So when you click on that, then a box is going to pop up. And this is where the box below is where you can search for the person that you're serving. So sometimes I think if you have the Medicaid number, it's probably quicker and easier to toss that in, or their DODD number, which is 5 or 6 digits long, or you can just search by their last name and the county that you're serving in. I feel like less is more. Don't feel like you have to fill out all these boxes and hit search. You can literally just put the person's last name and the county and then hit search. So we'll pretend that we did that. We put in, let's say the last name was Carson, and then it was Auglaize County, and we hit search. Once you pull that person up, can you go back one screen, Ann, real quick? Sorry. So once you're here and you find your person, you're going to click on their name. There's 2 hyperlinks right here. One, if you click on their name, takes you into the Medicaid site to where you can look up the details behind the services, or you can click on the hyperlink that's the individual number, and that will take you straight to the pause. I think the first place we're going to go is we're going to pretend we clicked on the name, and then it's going to take us into the more detailed site for Craig. So once you're in the Medicaid services site, I'll start off by saying there isn't anything in this site that you can click on that you'll mess up. It's read only. You can click, 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 and you're just fine, and you don't have to worry about messing anything up. And, always feel free to look around. So there's different tabs on here. I honestly don't remember which tab where you're going to take me to next. I'm going to look ahead real quick. You're going to want to go down to manage cost projections. So Anne's kind of circling that. The reason that we're asking you to go there is that will provide greater detail into what you're looking at. And you guys will get all these resources after this meeting and within a few days. So you'll be able to have that. Anyway, you click on Manage Cost Projections. And once you do that, it's going to bring up the second thing you'll do is you'll click on Get Waiver Cost Projection Details. When you click on that, then it's going to give you all that information that's sitting here below, where it has like the person's name, the span dates, who the provider is, because you're going to want to look for yourself in here, right? Let's say you're Nora. You can expand out all these, besides Sean's name would have been plus signs. Once you expand all those out, you can just keep drilling down deeper for the information. You can drill it all the way down, and don't look at these rates. This is from 21. These are screenshots from 21. These are old rates, so don't look at the rates. They're way lower than what they are now, which I'm glad they're higher. So you can drill down, if you look at the middle of the screen, all the way down to, like in this case, right, the rate was $4.93 for one span and $5.09 for the other span. If you're unsure what your particular rate is, this will be a good place for you to go drill down what your rates are and the time period. So if you look, you've got the span date. So in this case, from 7/1 of 20 to 6/30 of 21, Nora was authorized to serve Sean, Homemaker Personal Care, a total of 1,040 units for that particular span. And then for the fiscal split, we all know the fiscal split stops at 630. And then for another 1040 units with the rate for that span of time. So this basically is giving you the detail of what is in the pause. Because when you just look at the roll up or the summary of a pause, it does not give you all this detail. It just gives you units and dollars. But this helps give you a little bit more detail about the services that you're providing. And then the same thing, the other services that Nora was providing to Craig is HPC transportation. And in this case, units is miles. When you're thinking of HPC transportation, units is miles. When you're thinking of units for homemaker personal care, units is 15-minute units, right? So it's a little different. So for some independent providers, you provide shared living. In that case, you would be doing a daily rate. So 1 unit is 1 day at your daily rate, which is not shown on this screen, but I know a lot of independent providers do provide shared living, so I thought it'd be worth kind of throwing that out there. Does anybody have any questions on the details of this screen and how to get to it? This is always a good place to kind of look, just to make sure you're kind of on track with your authorizations. Okay, what's the next screen? All right, so in this next screen, we're going to actually, instead of clicking on the Craig Carson hyperlink, we're going to do the individual number. And that's where I told you could just go straight to the pause. So on this screen, this is another place where you can actually find the person's Medicaid number, by the way. It's all got nines on it now, but that's where you can find their Medicaid number. So it's also where you can look up suspension info if a person you're serving goes to the hospital. There'll be, I know we can't click on it because it's a screenshot, but that is also another place where you can see where you wouldn't be able, the times you wouldn't be able to bill for someone if they went to the hospital. So some of these have hyperlinks under them on the screenshot. Some have hyperlinks, some don't. The hyperlink, if it has it, it means that you've been authorized to serve at some point with that person. If it doesn't have a hyperlink, you were not in the pause for those spans that are listed. So once you click on a hyperlink, that's all you have to do. There's a bunch of them. You can click on any one of those hyperlinks, and you'd want to do the most recent one. And then it's going to actually take you to the pause. And this is not interactive, so you can't open it up. You can't see greater detail. This just shows you what you're authorized for a certain period of time, the units and the dollars. And then it will only show, let me think better about this. Well, let me just say this. You can also see up at the top under the pause plan information, the last approval date. So in this case, the last approval date was 4/7 of 2021. And typically it has the person at the county board who actually submitted the pause. Now, why do I tell you that? Well, sometimes it's helpful because if I see an error, then I know who I'm going to reach out to. For me, I look to say, well, who submitted that? When did they submit it? And if I see an error on there, I'll be reaching out, and if it doesn't match up with my pause, or sorry, my ISP, I'm going to probably be reaching out to that person or my SSA first. Does anybody have any questions on how to look at the detail or how to look at the actual, this piece of the pause plan? So what it does, sorry, if you go back one step, I'm so sorry, Anne. Yeah, so on here, what this screenshot doesn't show you is there could be multiple versions of a pause. It's usually a little pull down button. It's up there somewhere by the name of the person who submitted it. You can look at the different versions to see what changed. So if you were waiting on a change, let's say you're waiting on units to be adjusted, you can look back and forth at the versions to see if the change that you're looking for actually occurred. Thank you, Anne. Sorry about that. I always just think of something else. Okay. So on billing. So I talk to independent providers about this a lot. You can only be paid for services if they're listed in the ISP or your job description, right? So services are listed in the ISP. The service is also authorized in the pause. And what I tell folks, whether it's an agency or an independent provider, when you get that ISP back, you're going to want to make sure that it's everything that you agreed to. Make sure it's not any different than what you agreed to, because once you sign it, that's what you're agreeing to, right? So make sure, we all make mistakes. It happens and it's not on purpose, it's just mistakes. So look through the ISP very carefully, make sure that you agree with it, and then double check the pause. Log in like we just did and look at that pause and make sure that you're in agreement with the number of hours. If it's saying, I'm just going to make something up, if it says you're going to serve the person 20 hours per week, you're going to want to make sure that the pause has the equivalency of 20 hours a week listed in the pause. Otherwise, when you get to one of the fiscal splits or the end of the plan year, you're going to run out of money if it wasn't correct. And it's a lot easier to fix it in the front than to go to the end and call the county board and say, oh my gosh, I just ran out of units and dollars. And I've been delivering the way the ISP says, and then try to get that corrected. So I encourage you to do all the double check-in on the front end. And then if there are problems, reach out to the county board and let them know that as soon as you become aware. So paid for the services, if it's in the ISP, it's in the pause correctly, and then services were delivered as indicated in the ISP. So that's very important too. County boards are tightening up their belts, and I can tell you that it hasn't been as easy to get pause adjustments if you happen to go over. If something occurs, extenuating circumstances, you're going to need to get that approval before it happens or as soon as possible, because there could be different reasons for extenuating circumstances. But you're going to need to reach out to your SSA prior to, if at all possible, to get their authorization and approval. If you don't, you run the risk of serving and not getting paid if you're doing something that's outside of what the ISP says. And then, was your claim accurate and submitted within a timely manner, which you have 350 days from the date of service to bill a claim or to adjust a claim. So just making sure that you get your billing in on a timely manner. These are the steps to getting providing the services and getting paid properly. Okay, documentation. Documentation is a real big piece of all this. You can provide all the services in the world, but if your documentation, whether it's paper or electronic, but if your documentation isn't what it should be, it could invalidate a claim when you're reviewed. So if you provide the service, you get paid for the service, everything was the way it should be, but your documentation is lacking. If you get a review, that money could be taken back away from you if you don't make sure that you have all your billing and documentation. So there's about 14 elements that your documentation has to include. It's rule specific depending on the service. Your claim that you submit is not considered your documentation. Your documentation must be up to date and current. I do it every day and double check it. It has to be maintained in an accessible location. If a provider or a SSA sometimes even come out and review your documentation or compliance, through a compliance review, they most certainly will. You're going to want to make sure that it's accessible, and it must be made available upon monitoring requests. And that goes back to what I was saying about SSAs sometimes do their monthly monitoring, and they may ask for your billing documentation to see how things are going. And you're going to want to be able to provide that. So that's why it's very important to do it daily. Okay, claim submission. So I will say DODD for independent providers operates on a Sunday to Saturday cycle. Why this is important? Because that's also, if you're authorized for it, that's how they calculate overtime. Agency providers cannot bill for overtime, but independents can if you're not through shared living, but through HPC services. If you're authorized for it, you can be paid for overtime. So you submit a claim. Claims are due by noon to guarantee payment. They're due by noon on Wednesday. One could say they do continue to pick up claims all day long on Wednesday, but if you want a guarantee payment, I'd get that in by noon. DODD processes on Thursdays, and then on Fridays, your reports become available. So you get to see the outcome of what you did. So let's just say you provided services last Sunday to Saturday. You would have today's Thursday, you would have submitted those yesterday, unless you bill on a monthly basis, but you submitted those yesterday. So today's Thursday, tomorrow, the reports will be available. It's going to show what you billed. It's going to show anything that was denied. It's going to show, for those of you who are operating under EVV, because shared living's not, it'll show your EVV and what that turned out to be. And then day 4 and 5, the first line of defense I always say is DODD. So DODD puts their reports out there on Fridays, then the claims start getting processed by Medicaid. So if they get through DODD without any denials, then they send them to Medicaid. Medicaid runs them through their system. They check and make sure the Medicaid and the eligibility and all that is correct. And then they make the payment. It's about 14 days later, really. I'm going to look at the calendar just for fun. So if you submitted something yesterday, you're going to get payment on the 29th. I would say the 28th because they pay on Thursdays, but if it's a holiday week, they push it to Friday. So if you submitted something yesterday, you're going to get it on the 29th of May. Do you guys have any questions on the cycle process? Now you can submit, let's say you have rebills or, some providers do bill monthly. There's a lot of independent providers I know that bill monthly, and that's quite all right. If you are tracking your overtime, you're going to need to just be very careful with how you're tracking all of that. But it's perfectly okay to bill monthly. And it's okay, you can bill, it's due by Wednesday, but if you have your billing ready to go on a Monday, just go ahead and, you can go ahead and enter it in. It'll sit there until they pick it up on Wednesdays. Okay. So all your claims, oh, sorry, does somebody have a question?
Yeah, it's Jasmine.
Hey,
I
Jasmine.
just have a question about the last slide. Because
Okay.
I'm new, and so I don't. I'm just like starting off and trying to get clients. So when you say documentation, keep your documentation. Where do we document like on regular, like have a notebook and put like what we did for the client that day and dates and stuff? Is that
So
a
that's a great question, Jasmine. There's actually prescribed documentation forms. There are different forms out there, but there's like 14 different elements that have to be compliant that you have to complete on your documentation. So you would need to complete all those elements. I would encourage you to use prescribed forms, either that the county boards have. We have some prescribed documents we can jot down. Or you could read our email actually is at the end of the slide. You can email us and tell us what service you provide, and we can send you the proper documents. But you're going to want it, don't keep it on notebook paper, keep it on the actual documentation forms. That's going to be what's going to keep you compliant. Complete those every day at the end of every shift that you work so you don't forget. And then just maintain those documents somewhere in safekeeping because
Jasmine,
that's
if
your
you,
backup for your billing.
sorry, Christy.
That's okay.
Jasmine, if you are available for maybe 10 minutes after this session, I'm happy to stay on with you and I'll show you exactly where you can find the documentation templates. So you don't have to recreate them. You can use the ones that DODD has given out as templates.
okay? Thank you. Yep, I'll stay on.
All right, no problem.
Perfect. Thank you, Anne. That's wonderful.
Sure.
So all your claims have to be submitted through the Medicaid billing system or EMBS. When you remember when we were on our little blue tiles, we went to MSS. there is actually an eMBS tile. We'll touch on that here in just a little bit, but that's where it has to be submitted. There's no other portal to submit it through. You can submit your billing yourself, or you can choose to have someone else represent you to be your billing agent to bill on your behalf. I will say you're still responsible for the accuracy of your billing. So you're going to want, if you do hire a billing agent or have somebody else do it, you're going to want to still look at your billing claims to make sure you're in agreement. Everybody can make keying mistakes. You're just going to want to make sure that they're correct. So you're responsible for, if you do have a billing agent, you're responsible for having HIPAA requirements through a business associated agreement. And this is something that's federally required. Those are easy, accessible association agreements. And there's also an association agreement that we have to have. Your billing agent would have to have between you and them and give to the department, so the department knows you have a billing agent, and they'll allow that billing agent to see your claims and process on your behalf. But you only need to have that information if that's what you would choose to do, is have an agent. Okay, so logging on to eMBS. We're going to go through the same steps we went before. You're going to use your Ohio ID and you're going to log in. And then you're going to continue on, same as what we did earlier when we went into our MSS tile. So you'll continue here. And then remember our tiles that we had, our blue tiles under applications. Instead of choosing MSS, you're going to choose eMBS. Okay. So there's going to be a menu on here. Let me see. There'll be a menu to the left-hand side of the screen. It's going to say Home, User Guides, Billing Submission, Reports. You're going to want to click on Billing Submissions. And you'll see it really easily on the left-hand side of the screen when you click on that. So Leo is an independent provider. He supports one person named Mary Jones. He provides her with homemaker personal care and transportation. On April 2nd, he provided 6 hours of HPC and went 12 miles. They drove 12 miles to an appointment. So this was in Butler County, where Mary lives. And a few days later, Leo submits 2 claims, because depending, when you do a different service, it has to be a different actual claim. So 2 claims, one for 24 units of HPC and the other for 12 miles. So in this case, when you go to submit claims, you'll do the claim entry. So the contract number, the top line there, the date's going to default at the very top. That'll default to whatever day it is you're doing this. So Leo's contract number, that's going to be you have 2 different numbers. You're going to have a Medicaid ID, and you're going to have, as a provider, their Medicaid ID, and you're going to have a DODD number. You're going to want to use your DODD number. It's a 7-digit contract number. You'll put that there in the top one. And then in this case, Leo serves Mary. He's going to put Mary's Medicaid number in there. Be real careful when you're entering your Medicaid numbers. Even if it's one off, it'll deny. Then you're going to put Mary's first initial, and then the first 5 letters of Mary's last name. In this case, it's Jones, so that made it easy. You're going to choose the date of service. So in this case, if you recall, he served April 2nd, and you're going to put the month, day, and the year. Depending on the type of waiver the person that you serve has is going to depend on the service code that you use. If the person you serve has an individual options waiver, it's also known as the IO waiver, you're going to use the code APC. And there's a list of codes too that we could send out to you. But what I would encourage is, if you remember when we were back on the MSS screen, the very first screen we were on, and we looked at the details, it's going to tell your code in there that you're going to be using. So you put the code. The units of service delivered are 24. So if you remember, we said that Leo served for 6 hours. So you always there's 4 15-minute units in an hour, right? 4 quarters. So you're always going to take however many hours that you served. I'll just keep the math simple on this. However many hours you served and multiply that times 4, and that's going to give you your units. Then the group size is the number of people you served at that given time. In this case, it was 1, and staff size 1. Then you're going to choose your service county. In this case, it was Butler. And you're going to put in the usual and customary rate for that service. Now, remember, when we first was looking at MSS, we drilled down to get our proper rate, right? So you're going to put that rate that was put in MSS when we did our drill down, you're going to put that in here. You don't have to put the decimal's already there. So you'll just literally enter 5, hit your tab, or click in that next box, and 28. Then you're ready to submit your claim. So then you just click on submit. When you're ready to, in this case, they went 12 miles of transportation. So if we're going to also do the transportation, the good news, if you're entering multiple days, it's going to hold your contract number. You don't have to re-enter it. It's going to hold the Medicaid number. It's going to hold the person's initial, their name. It's going to hold the month, but it's in the year, but you're going to have to change the actual date. So in this case, it was the April 2nd. So you're going to have to make sure it says that. You're going to have to update the ATN. So you had APC in there. Now we're going to put ATN. That's the code for HPC transportation for somebody with an individual options waiver. So 12 miles. This is determining 12 miles. The group size is 1-to-1 because that's what you served in HPC too. The county is Butler, and in this case, this is not your current rates. Your current rates are 83 cents a mile, but back then it was 58 cents a mile. You don't have to put a 0 in front. You don't have to put the decimal, just put 58 in that field and then hit submit. When you hit submit of your claims, you're going to get a pop-up of a green reference number. You can enter, or you can write that reference number down on your documents that you submitted in case you ever need to refer back to that. I think that's helpful to maybe jot that number down. Does anybody have any questions about this entry screen? Can we just pop back on that entry? I'm trying to think of the folks who might be shared living. So if you're serving in shared living, you would pick put your person's information in. You would put your service code for you guys, it's ASP as shared living. And then the units delivered would be 1 because it's a daily rate. So 1 unit, anytime you have a daily rate, the unit's always going to be a 1, right? Because you're not billing units. So you would put 1 unit there, and then you would put the total usual and customary rate. Now, just a little note, you could put 200 or 500, you could put $500 under usual customary rate for any service. It's only going to pay you the cap amount based upon what was authorized for that person. However, if you make a keying error and say you put, instead of 58 cents here, you put 25 cents, it will pay you 25 cents a mile. So you got to be really careful to not put a lower rate than what you're authorized, because it'll pay it, the lower rate. It won't pay a higher rate, but it will pay a lower rate. So make sure that you have your rates correct. Does anybody have any questions on that? Okay. And this just kind of spells out what we just kind of talked through, submitting the single claim. It's just more detail. So if anybody that you serve has patient liability, and I don't know, hang on, we have a question before I switch topics. So for the billing month, you bill for the month. It's the month. So the date you're putting in of this, it's the actual date of service. If I'm understanding what you're asking, it's the actual date of service is what you're going to put in. Can we flip back up to that screen? I just want to make sure I answer a question. So the date of service, on this case, it was April 2nd. That's the date the date you put in is the date you served. So let's say you bill monthly. Let's say I'm going to enter all my April claims. Well, today's May 21st. I'm going to do the dates of service that I served in April. What I want to tell you, I've had several people ask me this question. If you serve somebody and and I'm going to talk about miles for just a minute. If you serve somebody and over the course of the entire month, you drive 250 miles, you have to outline each time you drove. You can't just at the end of the month say, I drove 250 miles and do one big claim for 250 miles. You have to do it with the corresponding date and HPC claim that it happened in, if that makes sense. Because I've had people ask if I can just bulk it up my miles, and you can't do that. You have to do the actual date of service that you drove. So let me go back to the chat. So is for the
So the question is really, I think, do you have to submit an entry for each day of the week? And so the answer is yes. Each date that you provided a service, you have to. So if you serve somebody on Monday, Tuesday, Wednesday, Thursday, Friday, you would have
Mhm,
5 entries, one for Monday, one for Tuesday, one for
mhm.
Wednesday, one for Thursday, one for Friday. You
Yep,
would then have the units that you delivered for Monday. So let's say you worked 3 hours on Monday. So that would
mhm,
be 12 units. And let's
mhm.
say on Tuesday, you worked 4 hours. That would be 16 units. So, yes, there is an entry for each day, and the units that you delivered for that day would be different for each day based on what you did. I think that
Correct.
is answers that question.
Yep. Yep. And you can't enter ahead of time. I've had people want to do that. Like, oh, I'm gonna see somebody. This is Thursday. I'm gonna see somebody on Friday. I'm gonna go ahead and enter that now. You can't enter ahead of time. It won't let you do it anyway if you try, but you can't enter ahead of time. But yes, thank you for that question. Okay. So if you have someone that has patient liability, I will say don't panic because you'll know. If you're thinking, I don't know if I have somebody with patient liability, you would know the SSA, the county board would let you know that. And really, the plain terms I like to say is based upon the person's income, Jobs and Family Services determines that that person has a copay, for lack of a better way to say it. They call it patient liability, it's copay. So has Medicaid providers, if we're required to account for a person's patient liability, if they have it, what we have to do is we have to deduct it off of our claims that we're submitting, and then we recoup the patient liability from the person served. So if I'm serving Ann and she has a patient liability or copay, of $250, I'm going to collect that 250 from Ann. Then when I process my billing to DODD, I need to let them know that I'm doing that. So I will submit my claim, but I will denote that I collected the money from Ann through my claims, and I can tell you how to do that. And let's say if it is 250, it's going to take a minute. Like it's probably not going to be through one entry. If you're only serving a few hours a day, it's going to be over the course of probably several. And in the example, that's how it is. But what ends up happening is you're going to enter your claim in the top part of your claim, just as we just did, right? But down under the source code, you're going to put, I think it's a one in the source code. I have to go back and look at it's been a minute. You're going to put in the source code a one, and then the source amount is going to be whatever it is to try to get you to that amount. So in this case, if it was $250, so let's tally up this claim. 24 units times $5.28. This claim that we're looking at right now would be $126.72 is what the claim would be worth. I would actually, in this case, have to put a one in the source code, and I would have to put under the other source amount. That box would light up once you put something in another source code. Then I would put 126.72 in that box. Then when I enter my next day's claim for April the 3rd, assuming I served Miss Jones on April the 3rd, then I'm going to say, okay, well, I took 126.72 out already, and my goal is 250. So now I got another $123.28 I have to deduct off. So let's say you serve 24 units the next day. You're going to put under the other source amount 123.28. And basically, you're going to get paid the difference. I just tried to do the math really quick and be swift about it, and I messed up. You're going to take the 126.72 and minus the 123.28. So really, well, I did it wrong again. I'm trying to do it too fast. 72 minus 123.28. So really, you're going to end up with a claim for $3.44. But all this does is just tell the department, tell Medicaid, yes, I collected it. Here it is. I deducted it. Think of health insurance. I deducted off the copay first, then DODD's paying the rest, if you kind of think of it in those terms. If you do have somebody with patient liability, here's what I'll tell you. And you're running it through the first time, just email me and I will walk you through the steps. It's kind of confusing the first time you do it, but if you have that scenario, just message me and I will walk you through how to do it the first time. Yes, the source code and the amount only means to show that the payment is being made late. This is absolutely only for patient liability, not for your regular billing. If you're just doing regular billing, you just ignore the other source code. And again, if you have patient liability, you're going to know it because you're going to get a letter from the department or a letter from the SSA, the county board, that's going to tell you, they're going to say, hey, Bill, the person that you're serving has patient liability. It's this much per month. And typically you deduct it off the first of the month claims, like whatever your first day of the month is, you work with the person, you start deducting it until you satisfy it. Okay, overtime. For those of you who get overtime, who are authorized overtime, you can only do it if you're authorized. They have a different code that's used and they'll tally it up. So it runs from Sunday to Saturday, right? And once you hit the 40-hour mark or 168, I think it's 168 units or 160, 40 times, yeah, 160, sorry. Once you hit the 160 unit mark, anything you do after that in the week from Sunday to Saturday, anything you do in that week after you hit 160 units is overtime. So let's say you hit overtime midway in working on a Thursday. You hit it midway. You've provided services all week, midway through Thursday, part of your day is overtime. You're going to submit all your non-overtime claims using if the person's on an individual options waiver, an APC code. And as soon as your units start going into overtime, any of those units, the code will be APV if it's an individual options waiver. If it's a level 1, it's the F codes. Then you would use the F, like the FPB. And then if it's FPC, if you're serving someone for a level 1 waiver under regular HPC that's non-overtime. So it could be that oh yeah, it is on a Thursday. So in this particular case, and this is demonstrating in a person with an IO waiver, you had 32 units on Sunday, 32 units on Monday, Tuesday, Wednesday, and then Thursday, by the time you got there, you start pouring into overtime. So on Thursday, you're actually going to have 2 entries for your homemaker personal care. You're going to have 32 units of, it would be APC, and then 16 units of APV. I just stuck with that, even though it says FPC, we're sticking with the same waiver type because that's kind of confusing the way that. Let me see. Oh, I see. It was with a different person. Sorry. Let me go back. If you're providing services to more than one person, it's where the overtime lands. So that's what this is trying to demonstrate. So this person served 2 people. And so the overtime hit when they were serving the person with the level 1 waiver. My apologies for not getting that straight. So it's wherever it lands. I get this question all the time. The overtime does not go against the person's funds available in their waiver, their budget. I just wanted to make sure. I know a lot of families ask me that question, and it doesn't. The Ohio Department of DD pays the overtime piece. It does not impact a person's waiver. And the reason that families was concerned, like, well, if the overtime keeps falling on my son or my daughter, then it's impacting their budget more than anybody else's budget, if you see what I'm saying. And it doesn't. I just wanted you to know that. But in any case, if the overtime happens during it's kind of split during your time, then you could have two claim entries for that particular day. And again, if you do run into this, I will walk you through your first one. Don't stress, just send us an email and we'll walk you through your first entry of how to do it so you have an understanding of it. Okay. So this is let's say you entered in your claim and you enter in your claims, hit submit, enter submit on the screen that we was in previously, and you're all done. You can do different things here. So there, you see below, there's when you click under, you have to click under the upload flat file to see what you did. So where you guys would have entered in would have been under the single claim entry. If you look over here at the left, you would have entered in under single claim entry. Once you're done entering in under the single claim entry, you can go look at your work and click on upload the flat file. When you do that, you can see a delete plus one, a view, or a download. I would suggest after you enter in, you go view it and make sure that you keyed it right, because everybody, we're people, right? People only make keying mistakes. So I would view it and make sure you feel good. But let's say you're like, oh my gosh, I used the wrong code the whole time. Christy was talking and I thought it was FPV and it was supposed to be APV. You can actually delete the file. So let's say you didn't, because you can't edit files. Once you've keyed in in EMBS, you can't edit it. You have to delete the line or delete the file and start over. It doesn't allow you to edit. So in this case, you have the opportunity to delete. If you do delete, you'll need that green reference number to be able to actually delete the file. It won't let you just click delete and it's all gone. It asks you, are you sure? What's the reference number? And then the delete plus one is where you could literally say you made a mistake on one line. You could hit the delete plus one. It'll show you all the lines that you entered, and there'll be a delete button on the left-hand side. And you could literally just find the line that you didn't like and delete it. Then you could go back into single claim entry and re-enter it the way you wanted it. But I would suggest viewing your claims after the fact. Now, I've seen something popped up here. Did they just stop the provider for the overtime? No, no, no. Independent providers can still be authorized for overtime, but you have to be authorized for it. Deborah, is that what you're asking me for? They haven't eliminated overtime for independent providers. Okay, perfect. Agency providers cannot, but independents can. Do you guys have questions on this page? I wish we could show you in real time, but because of HIPAA and all that stuff, makes it a little challenging to show you real time.
I did just want to comment on the question about did they stop overtime? So Christy's right. They have not. There is still an overtime rule. That rule is still in effect. But I can tell you that what we're seeing are more and more county boards being very purposeful in reviewing overtime. I think especially having worked at the department during COVID. I think we all know that during COVID, there was a huge staffing crisis. We had staff who were out for, weeks and weeks at a time because they themselves had COVID, et cetera. Excuse me. So overtime was a little more frequently used during COVID. And I think now that we're going back into kind of some normalcy, the county boards are going back and really looking at the authorization of overtime using the rules that are in effect. So hope that helps.
Thank you, Anne. I appreciate that. Yeah, I think they are being a little more stringent on times now. Okay. So, mm, okay, so this
I
is if
think
you,
did we already talk through all of
we
this, or did
did, but it's
yeah.
probably
Okay.
fun to actually look at. So if you
There we go.
click, yeah, if you click on delete the file, this is where if you actually clicked on the word delete, it's going to pop up that box, and that's where you have to put your reference number in, and then because it makes you make sure you're sure. You don't want to get rid of all your hard work, not the whole thing, because this literally deletes the whole file, and you really want to make sure that you want to do that. And then if you want to do the delete plus one, um, you would click on the delete plus one and it's going to bring up this next box. And remember how I was telling you, it says delete at the left-hand side. You pick what line. Once you hit delete, it's still going to say, are you sure about that? And I even think it asks you like 2 times. Once you do that, then you have to click process deletion for current page. If you just click delete and you don't click process the deletion for the current, if you don't, for current page only, it ain't going to take it. It won't take it. You'll hit delete and then you'll think, oh, it's deleted. It's not until you hit process that deletion for the current page. So you have to follow that step. Yeah, Deborah wanted to know if we could send information about the overtime. Yeah, we can send some information out. And would you want Deborah to send it so we don't lose track of emails, to send it to your email and then you can respond? I didn't hear, but we can get that information out to you. Okay. Denied claims. Claims that are submitted that are error-free when forwarded to ODM. They get it reviewed and approved for payment. And again, like I'd said before, DODD is the gateway on Fridays. ODM, or Department of Medicaid, is the second level. If they submit a denial, it's considered a reimbursement denial, ODM, that is Medicaid. It's not going to show up on Fridays. It's going to show up the same date the invoice drops, that 2 weeks later, it's going to show up. And typically, if Medicaid denies it, it has something to do with the person's actual Medicaid eligibility or just eligibility in general. So you're going to want to review your reports when your payments drop to make sure that there isn't a Medicaid eligibility issue. And the reason I say that is if you're an independent provider and you're responsible for, in the ISP, for maintaining a person's Medicaid eligibility so they can go to the doctor and prescriptions and all that kind of stuff, it also impacts you as a provider, because if we don't maintain the person, if you're required to and you're not maintaining the person's Medicaid eligibility, then that means they don't get paid, or sorry, that means they can't access any Medicaid service, including services that you provide. So if you are responsible for that, you're just going to want to make sure you stay on top of the Medicaid eligibility portion. Okay. Does anybody have any questions on that? No. Okay, so where you find the weekly EMBS reports is the same place where we log in to view or to enter in your claims. So if you go back a couple screens, Anne, I just want to point where that's at. Oh, sorry, the other direction. Sorry. A few more. Let's go back to where I can see that. Okay, one more down. Yes. So you know how under single claim entry, that's where you enter in, and then upload is where you can view. Down under reports, that is where your reports are going to be on Fridays, right? So that is where you're going to review all the different reports that's available, whether it's billed, whether it's denied. Your invoice is going to be in there when you're going to, and how much you're going to get paid. That's where you're going to go find it. It's all on that one screen. Thank you for doing that. So you'll log in, just like we did, go to the EMBS tile. You're going to navigate to where Ann just showed you, and then you're going to choose the cycle week that you want to review from the drop down. So if you just billed on Wednesday, you're going to be looking for May 26D on Friday. When you go look tomorrow, you're going to look for May 26D because that's going to be whatever you submitted on Wednesday is going to be included in those reports. So every Friday, you're going to have your billed and denied. You're going to have your EVV report. And then on Mondays, you're going to have your reimbursement denieds and your invoices. So utilization reports, they switched it. It used to be in a data warehouse is what it used to be. That's gone. They sunsetted it, and now it's Tableau. So these utilization reports can help you keep track of how many units that you've billed. The utilization report typically is just the pause. It's going to show like the total dollars you were authorized, the total units. And then as you bill, it's going to deduct off of that. Think of it like a checking account, right? It's going to start deducting off what you've billed, and it's going to show you what you have remaining in dollars and units. And it'll show you the trajectory to which you're billing, what your utilization is, and what it will end up being if you keep billing on the same trajectory that you're billing on. So this is really helpful so that you don't run out of funds or you don't overutilize. If you start seeing yourself overutilize, you're probably going to want to tap into why. Now, if you checked everything in the beginning, your ISP against your pause, remember we talked about if you serve 20 hours a week, you're going to want to make sure your pause is equivalent to 20 hours a week in authorizations. If you checked all that and you followed that plan, you shouldn't have a utilization problem. And then it will also show you the total amount that you was reimbursed across the year, not only just the span, the fiscal split, but the entire span year for someone. Okay. So billing support, you can call DODD at the support center. I have been told that it gets kind of backed up, and I know that. I know saying this out loud, but you can call the support center. Sometimes it does get backed up. You can also call your provider support liaison at the county board. A lot of times they can help through some challenges that you might have if you're not sure about something, but there is billing support that is out there. Okay, so this session will be on our YouTube Network 19. We will put that out there. Our next session is going to be June 18th at 11:30 a.m. We don't have a topic ready yet, but we will have one that's going to be pertinent to what you're working on. We'll have that ready. We'll send that out with the materials that we have from this presentation.
There is one last question in here. Bill asked, what is the download used for?
So it downloads the actual flat file. And if you look at it, Bill, it's not really readable and probably not very helpful, honestly. It's like lines of data. And that's how DODD accepts it. It's probably not super helpful. I can tell you, we bill for a lot of people. I never use that feature. It would be rare that I would use that feature on the download. And yeah, anybody who wanted to see how to get the forms, Tiana had a question about, can I stay on to see how to obtain the forms? Yes, absolutely. You can stay on for that.
Yeah.
Now, I
So
think
if
we had some extra information, Anne.
yeah, so anybody who does want to stay on, I'll stop the recording here in just a second, and I'll be happy to show you exactly where you can find it's not claims forms. What we're going to show is where to find the documentation templates. So how you document services, which then in a review needs to match your claims. So feel free to stay on if you'd like. Thank you, Christy, for joining us and going over the billing fundamentals today. We hope that you all found it useful. Like Christy said, you will get a copy of the PowerPoint presentation, so you will have all of those screenshots so you can use them as you are doing it for the first time, or you can certainly reach out to us and someone from 19 Services will be happy to kind of talk you through or help you through it if you need help. Thank you for joining us. I'm going to go ahead and turn off the recording here, and we will jump into. All right, stop sharing and recording.